This is an anatomy review of the brain. The brain is by far the most complex and least understood part of the body. In part for that reason, because we don't have time within this last week of the course to truly dive down deep into the specific anatomy of the brain, this anatomy review will be relatively cursory. The major areas of the brain include the cerebrum, the cerebellum, the diencephalon, and the brainstem. Made up of a frontal, parietal, temporal, and occipital lobe bilaterally, the cerebrum is responsible for integration of complex sensory and neural functions, as well as initiating and coordinating voluntary activity in the body. Sitting inferior and posterior to the cerebrum is the little brain, or the cerebellum. The cerebellum has multiple complex functions. However, simplistically, it can be thought of as being the central origin of motor control. Within the interior of the brain lies the diencephalon. The diencephalon includes the thalamus, the hypothalamus, the epithalamus, and the subthalamus. The diencephalon is responsible for relaying sensory information between brain regions and controls many autonomic functions of the peripheral nervous system. Lastly, anterior to the cerebellum and inferior to the diencephalon and the cerebrum, is the brainstem. The brainstem includes the medulla oblongata, the pons, and the midbrain. Although there are more functions than this, the brainstem is responsible for controlling body functions as heart rates, blood pressure, and breathing. Looking at the cranial nerves on the inferior aspect of the cerebrum, as well as the anterior aspect primarily of the brainstem, what you see highlighted in yellow here are cranial nerves 1 through 6. Beginning anteriorly, cranial nerve 1 is the olfactory nerve, seen here as both the olfactory tract and the olfactory bulb. The olfactory nerve is a sensory nerve that is responsible for the sense of smell. Moving posterior to cranial nerve 1, we have cranial nerve 2, the optic nerve. The optic nerve, again, is a sensory nerve and is responsible for vision. Continuing posteriorly, we have a grouping of 3 cranial nerves. First, the oculomotor nerve, cranial nerve 3. This is a motor nerve, which is responsible for movements of the eye, as well as changes in pupil size. Adjacent to cranial nerve 3 is the trochlear nerve, cranial nerve 4. This as well is a motor nerve, which is responsible for movements of the eye, specifically the diagonal movements of the eye from the superior oblique muscle. Posterior to that grouping of 3, we'll come back to the last little nerve there, is cranial nerve 5, the trigeminal nerve. The trigeminal nerve has both sensory and motor fibers to it. It is responsible for the muscles of mastication as well as sensation to the face. Lastly, in this group, cranial nerve 6, the abducens nerve, is going to work along with the oculomotor nerve and the trochlear nerve to provide one last movement of the eye, which is abduction of the eye, so lateral movement outward of the eye. This is a function of the lateral rectus muscle. Seen here in green, then, are the remaining cranial nerves, cranial nerve 7 through 12. Beginning with cranial nerve 7, the facial nerve. The facial nerve is both sensory and motor in function, innervating the muscles of the face and providing sensation primarily for taste on the anterior 2/3 of the tongue. Posterior to cranial nerve 7, we see cranial nerve 8, the vestibulocochlear nerve. The vestibulocochlear nerve is a sensory nerve which is responsible for our vestibular system as well as our hearing system. So it allows us to hear. It helps with our balance and coordination. Continuing posteriorly is cranial nerve 9, which is the glossopharyngeal nerve. The glossopharyngeal nerve is sensory and motor in nature, innervating the pharyngeal muscles, allowing for swallowing. It's also responsible for taste sensation along the posterior third of the tongue and is an important nerve for heart rate regulation. Cranial nerve 10, or the vagus nerve, is next. The vagus nerve is both sensory and motor in nature, innervating the muscles of the pharynx and the larynx. It's also responsible for the gag reflex along with the glossopharyngeal nerve and is an important nerve for parasympathetic innervation, so heart regulation, breathing regulation, as well as the gastrointestinal tract. Sitting adjacent to the anterior aspect of the brainstem, I can get it here, there we go, is cranial nerve 11. Cranial nerve 11, better known as the spinal accessory nerve, is a motor nerve which is responsible for innervation of the trapezius as well as the sternocleidomastoid muscles. And then lastly, cranial nerve 12, the hypoglossal nerve, is a motor nerve which is responsible for movements of the tongue. Of the various mnemonics to help you remember the cranial nerves, one of the oldest and most common that you'll come across, of course, is "On old Olympus's towering top, a Finn and German viewed some hops," which represents the olfactory nerve, optic nerve, ocular motor nerve, trochlear nerve, trigeminal nerve, abducens, facial nerve, the auditory/vestibulocochlear nerve, the glossopharyngeal nerve, the vagus nerve, the spinal accessory nerve, and the hypoglossal nerve. Of course, there are other mnemonics for which we will not discuss here. To help you remember the functions of these cranial nerves, you can remember the mnemonic, "Some say marry money, but my brother says big brains matter more."